call this meeting of the Dalton Selectboard to order, please. All those that can, please stand for the pledge. And Mark, would you lead us in the pledge, please?
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, liberty and justice for all.
Thank you. Brittany, could you do the roll call, please?
Is Brittany in?
I thought I saw her cell phone on there, Sandy. Oh, I will do the roll call. Joe Diver.
Here.
Dan Esco.
Here.
Mark Stroud.
Here.
John Boyle. Oh, where's John?
There he is.
Okay. Okay, John, you there?
He's connecting.
Yeah, there he is.
All set, John?
Yep.
Okay, good. We're just taking a roll call. I just called your name.
Okay, I'm here.
Okay, and Bob Bishop's here, and Sandy Albino, our acting town manager, is here.
I'm here.
Okay, great. Okay, first of all, the minutes of October 26, 2020. A motion to accept, please.
Yeah, just a minor correction, Bob, on the minutes.
Okay,
Where it says intro. This is a meeting that you were absent, and it says intro, our bishop. And I actually read that into the record.
okay.
I think that's the only thing that I saw on it. Other than that, motion to accept with the with that change.
Okay, is there a second?
Second.
Okay.
Good.
Oh, motion been made and seconded. Roll call vote. John?
Yes.
Joe?
Yes.
Dan?
Yes.
Mark?
Yes.
Bob, yes. Okay. Public to address the board. This is a time when the public may address the board on any item listed on the meeting agenda or any issue or matter of the town. If you intend on addressing the board at this time, we ask you to do the following. Use our Zoom link that was on the agenda or dial 684-6111 extension 28. Please identify yourself by name, address, or the company/institution you represent. The public address to the board segment will last no longer than 30 minutes. Please make your comments concise and try not to repeat statements made by others. Please address your comments to the board chair. Discussion or debate on any issue may not take place at this time. The chair or the designee may answer questions on procedural matters. Please be cordial and respectful of others. If anyone wishes to be recognized when the board discusses an agenda item, please make that request at this time. The board chair may grant this request, address comments to the board chair, and be concise. Is there anyone out there that would like to speak on any of the agenda items?
Hi Bob, Richard Hall, 164 Green Ridge Drive. Can I be recognised for item number 7?
Yes.
And I did have a question on number 10. It says questions and answers. Do you have to be recognised for that?
Let's make it legal, yes.
Okay, thank you.
You're welcome. Anyone else?
Mr. Bishop.
Hey, Dan.
How are you? How you feeling?
Good, how are you?
Good, thank you. I just want to be, let the board know I'm available if there's any assistance I can give to Jane on question 7 about
Okay.
The information we've been receiving about COVID.
All right, appreciate it. Anyone else? Okay, before we get started, I'd just like to swap items number 10 and 9. I would like to move up the Central Berkshire Regional School District ahead of the licensing board. They really shouldn't have to sit through that because their time's valuable too. So if no one has an objection, can we do that?
No objection.
Okay. Okay, first item, FY21 tax rate classification hearing. Sandy, I'm going to turn this part over to you right at the moment.
Okay, so every year, annually, we have to have the classification hearing to decide whether or not we're gonna have a single rate or a split rate. And this is necessary so that we can fill out the form in the tax recap on Gateway in order to complete the process. So I'm leaving it in your hands, Bob, to go forward with what it is your pleasure is for the tax rate this year.
I believe, Sandy, we never deterred from the 1-to-1 tax rate. Am I correct, Mr. Boyle?
Factor of 1, yes.
Yes. Okay. What's the board's favor, or do we still want to support the 1 tax rate?
Mr. Chairman,
Yes. Go ahead, Dan.
it would seem that we don't quite have the commercial tax base to move beyond a factor of 1. We're at 16% and the recommended is 20 to 25, so I felt that was a compelling statistic.
Good pickup.
Yep.
Okay. Anyone make a motion?
Mr. Chairman, I move that we adopt a factor of 1 in setting this next year's tax rate.
Okay. Is there a second?
Second.
Okay. Motion's been made and seconded. Is there any further discussion? All right. All those in favor, roll call vote. Dan?
Yes.
John?
Yes.
Mark?
Yes.
Joe?
Yes.
And Bob, yes. Thank you, Sandy. That was pretty...
Mr. Chairman?
Yeah, go ahead, John.
Yeah, I think there's 2 parts to this. We have to... Sandy, do you have it at hand?
I do. Are you talking about the options? The options page? Selection of a discount for open space? Granting a residential exemption?
There was something else similar to this that we always adopted. I forget what it is, though.
Granting a residential exemption? Granting
No.
a small commercial exemption?
No. It was an affirmative.
I'm thinking you vote a residential factor of 1 because
Right.
Dalton doesn't have a large commercial base.
Right?
And the Dalton has not granted small commercial exemptions.
No.
The select board signs the LA 5 through Gateway after the vote to adopt a residential factor. Those are the things I know about.
I can't remember what it was, but it was always a minor thing that accompanied the main issue of approving a factor of 1.
John, can we do some research on that and come back and amend this vote if we have to?
Sandy, is there a deadline here for getting this in?
Yes, there is. The
When
tax,
is it?
like this week. I'm completed that information in Gateway. The last thing I'm waiting for is this adopting a residential factor of 1.
Yeah. Maybe, Mr. Chairman, a motion to vote, the board goes on record of supporting any auxiliary motions that are necessary to setting a residential factor of 1.
That's a good point, John. Is there a second?
Second that.
Okay. Motion's been made and seconded. Any further discussion? Dan?
Yes.
Mark?
Yes.
John?
Yes?
Joe?
Yes.
And Bob, yes. Okay. Thank you.
Thank you.
No, good work, Sandy.
Thank you.
Okay, next one is, Board of Health updates. Jane, I see you're here. And we'll turn this over to you at this point. Yeah, you're muted. Jane, you're muted.
You would think that this was my first day. Board, this has been a busy week. As you know, the Dalton is in yellow, meaning that our numbers are high enough that it's one, there's gray, which we had been previously, green, yellow, and red. And what that means as far as ramifications is if we end up in red for 3 weeks or more, it's going to change our gathering limits and some other things. So we're trying to do everything we can to keep our numbers down. As you might have heard, this increase has been traced back to clusters of small gatherings, both before and during Halloween, and it's impacted our schools. It's impacted, I've heard from just this week industry, like classes for like young people. I've heard from different varying town offices. It's really spreading in our sector and the entire town, and we just really need to remind people that there are things that we can do. And in fact, the state of Massachusetts launched a program called Get Our Masks Back, and basically here's the things, Massachusetts, that we need to do to get back on track. And so that just came out tonight, so that hasn't been updated on our website, but it will be. And also going to be sharing it with the Dalton Community Television, who has posted some of our other things for us. So, hopefully everyone's getting the message. And so that's that. Excuse me, I have something in my teeth. One of the things that we're really trying to do from the Board of Health end is developing a guide for people so that to help not just the town, but also people in general about, when is it that you have to quarantine, what precautions should be taken. And so what I've done is provided 2 documents that I'd like that I'm putting before the board for your review and and consideration for approval tonight. One is really kind of basic. The Department of Labor Standards requires us all to have a COVID control plan, and it tells us what we need to have in our COVID control plan. So there's things that would impact the town. There's COVID control plan for offices, and I emailed you that draft earlier today. You may or may not have had a chance to look at it. If it would please the board, I can certainly share the screen. There's only a few items that when I went through that I felt like I needed input from the board, and I highlighted those things so that they were easy for you guys to buckle onto and make a decision about. This process of creating the COVID control plan, and then as well as the policies that were sent to you this weekend, was a collaboration using existing materials and then input from many different department heads and the Board of Health. And so what I hope that we have is a really strong document. I was able to speak to Tim from KP Law. And so we went over some things, and so they're pretty tight on my end, and for you guys, it's just a matter of deciding whether or not that's the route that you guys would like to go. So Bob, I'm not sure how you want me to handle it. Would you like for me to try to just show you the documents? And should I email you, or should I post the documents on the chat and everyone open them? I just want to, there's a few things that I do need guidance from you guys on. It won't take a real long time, but how do you want to handle?
Can you share it on your screen, Jane, so we can see it?
Mm-hmm. So Sandy?
Yes.
You go to the very bottom of your screen, there's a share screen button. It's green.
Yep. And
But if
that,
you click that, so enable screen sharing.
so where do I do that?
So if you click on the bottom, what does it say when you click on the green share screen?
It brought up a window, and it says share. A blue, should I click that maybe?
No, that's going to share your screen. Why don't I can send it in the I can do it in the chat, and then I can just talk to you guys through it. I don't know
Okay.
if that complies with the open meeting law or not, but
Well,
it's
we
the
can
best we
see
can
it.
do.
And I can, yeah, I don't know. Joe
There's nothing
Deaver,
that says enable screen sharing.
share, optimize screen sharing for video clip. Maybe if I go to advanced,
Sure.
I don't see anything. Joe Diver was able to walk me through this. Is he there?
Sandy, just go to Jane's
Yep.
square and go to the 3 dots and make her the host.
Go to the 3 dots. Oh, over here? Oh, got it. And make host. I got it.
Thank you, Dan. I didn't know that.
Becky Slick put it in the chat.
Ah,
Oh, way to go, Becky Slick.
thank you, Becky. Thank you, Dan.
All right, so share screen. So I'm going to go through the control plan first, because it's the foundation for what. And I'm going to go through this kind of quickly. So if anyone wants me to stop, just stop me. How's that?
Okay.
Okay. So here we have the prevention control plan. So this comes from the Department of Labor Standards, mandatory work standards for office. So it talks about there's social distancing, hygiene protocols, staffing and operations, and cleaning and disinfecting. Those are the 4 foundations that this plan is. So, we've gone through, we've made sure everyone's distant 6 feet apart. We assigned suggested capacity for each building or each office or room in town hall. And so we're pretty tight on that. I'm working with Pat to put up some signage and also putting this adjusted occupancy outside of each room. So hygiene, I've talked to Pat, he's agreed that we're gonna be on the days that the cleaning people don't come in, that we're just gonna have wiping down of those high touch surfaces. Staffing and operations, my intent is to have a training next week with everyone that works in the office, so that's everyone, right? And then have one for DPW, offer it to the police if they'd like, and the other, also the historic commission, we'll get some information. I'm not sure if they'll get an actual training or not. So the next piece, it says, see how this is highlighted. This is because this is a point of discussion. The standard says that the employer shall ensure that that employees are self-screening or are being screened, that they're not exhibiting COVID symptoms, that they are not a close contact with someone who's got COVID, and they haven't been asked to isolate or quarantine by the public health nurse. Because we don't have our own public health nurse at the actual town hall, and because I'm not in every day, the approach that I'd like to propose to the board is to have a self-screening. And so what I've done, and you'll see it on the next document, is make a sheet so that every day that people can write their date down, and then just check off that that they don't have symptoms, that and then they would just keep that in their desk, and I would just go in and try to reinforce it verbally, and it's not entirely like someone or someone else going through and actually taking people's temperatures. We thought, but it's something. And are you guys okay with using a COVID daily screening log to meet that standard by the state?
I have no objections.
No objections.
Okay, great.
Sounds great.
One question I do have, Jane, is do they have the little temperature guns so they can take their temperatures?
the police have one, and there's one, there's just one other one in town hall. I thought they're not that expensive, and I've thought about getting some for the offices, because the problem is that it's no touch on your forehead, right? But really it's your hands that are the big problem. So if people aren't wiping it down in between, then it's kind of defeating the purpose. So we might need to get some different temperature guns for the different offices, or at least one temperature gun that could be shared in an office, just to reduce the amount of people who would actually be touching it. That's a good question. The other thing is just really keeping a log of who you're with, right? As we've seen townwide, is really what happens if someone comes down with COVID. It really comes down to, all right, who were you within 6 feet of for 15 minutes or more? And there is some science to back up, but like 6 feet and 15 minutes isn't a magic number, but we have to have a threshold, and that's the threshold that the state of Massachusetts has chosen, and CDC, for close contact. So, so we're asking people to, and this will be part of the training, is keep track of kind of who's in your office, so that we can track these things. It makes it so much easier when we don't have to start from nothing. When we do have a notice of a positive, and they are coming in occasionally. Of course, if you have a medical condition or disability that counters your use of a mask, one of the changes that happened with the last mask mandate is you can have that exemption, but as an employer, we are able to ask for documentation of that. To my knowledge, I'm not aware of anyone who's claimed that exemption, but that is something. I guess I read that wrong. We're not in that section, but never mind. So the other kind of area that I wanted to talk about is, some people in the office can work from home, some can't. But what I was finding when I went through and measured all the offices is, there's specific computer programs for the specific offices. So if there ends up being an increase of cases within the town hall building, we might ask offices to start splitting up, just so that we can have continuity of operations. And Dan Filio has done a lot of work on identifying, that we don't have a lot of cross training in between offices. So just for town continuity, if we end up having a cluster that's impacting town hall, I might request to go to that model. And I wanted to know what you guys thought about either having people telework or adjusting the shifts similar to what we did in the spring.
I think it's a great idea, Jane, to be honest with you. I'm in favor if they want to do it now, to be honest with you, if you want to keep everybody safer with the numbers going up.
And the thing that I have been hearing is when people are sick with COVID, they don't really want to be on the computer working. It's people have to follow the travel order. Well, you guys can read. But then the next thing, is the notification. So if someone has COVID symptoms or tests positive for COVID-19, there's a lot of concern around making sure that they have a right to privacy. Okay, they have a right to privacy, and we have, as a town, we have to ensure the safety of our workers. What do we do for the safety of our workers? One thing that we do is if that person has been in close contact with any of the other employees, we want to notify those employees as soon as possible so that they can stay home, right? And start their quarantine. So that's one thing. That's why the town needs to know if there is a positive case or if someone's having symptoms that, really look like you probably have COVID-19. So the other thing is cleaning and disinfecting of the offices. And this is something that I talked to Pat about today. And, the way that this reads right now is it says employees who have COVID symptoms or test positive for COVID-19 and have been at the workplace shall disclose their diagnosis to their supervisor, who shall notify the Board of Health, or it should say notify the Board of Health for purposes of cleaning, disinfecting, and contact tracing. What we don't want is we don't want people to feel like they need to tell, they really need to tell somebody. And so we provided two different methods kind of getting through that. So my question for the board, and I'm sorry my question for the board is, I think the Board of Health is nice to know, either the public health nurse or myself, because we can really identify the level of exposure, and also we can decide whether or not people need to be notified that are employees. So I think it's important that the Board of Health, either me or the public health nurse, are included in that. My question is are you guys fine with them notifying their supervisor, and if they're not comfortable doing so, notifying the Board of Health, or should they always go through their supervisor?
There's a question I have on this that I was just thinking about actually earlier today on another call, Jane, is just the privacy of the employee, even though they might be COVID symptom or COVID positive. In larger organizations, there's an employee health angle and the privacy is maintained, but the notification is also released. But we don't have that in a small town. So how do we handle our employee health situations now? Where do they go to currently?
What has happened, so like examples is people have been pretty upfront. Most people have been pretty upfront about when they're having symptoms. And so right now it's been going, I know that it's gone through Sandy and it's come to me. Sandy and I spoke about this earlier today, and jump in, Sandy, if you disagree with what I'm saying, but you know, sometimes people think that that they've been exposed when they're actually not an exposure. And so we felt that it was better for employees to have the option to go directly to the Board of Health to maintain that sense of privacy. And the other thing is it's really hard to know how to clean and disinfect without, so like if someone said, let's say I came down with COVID and then I called Pat and said, hey Pat, you need to clean the building / Board of Health office, and he goes in there and the building inspector's in there, he's gonna know that I have COVID. But we haven't really been able to figure out a way around it so that those spaces get sanitized in the way that they need to, and not have some indication of who it is. We're just such a small organization.
Right. So it's fun. I'm kind of leaning towards the Board of Health to receive a report, because then there's immediate action on the trigger events of what needs to occur.
Yep.
Otherwise, it kind of goes to the supervisor and then over to the Board of Health. Let's just make it as streamlined as possible is my recommendation. And then they can tell their supervisor if they want, but they're not required.
Right, I think they should go right to you, Jane, because that's time's essence here, so you can get right on it and start the tracing.
Yeah.
Right? I mean, if we get a day or two delayed, it's not a good thing.
And I've been working closely with our public health nurse, so when we get something like that, I reach out to her, and then we're kind of a team when it comes to things like that. So.
Good.
Okay.
I think you should leave it open, though, like you said. If they want to go to their supervisor, they can go to their supervisor or the Board of Health. But if they go to you, Jane, you should immediately let the supervisor know so they can lock down the area or whatever they need to do. So I think we need to leave that open a little bit.
Yeah. So what it said before is their supervisor who shall notify the Board of Health or notify the Board of Health. The other thing is like if they notify me, and let's say it's in the clerk's office, I could call Deb and there's been an exposure in your office by one of your employees, and she'll know. But we do have to try the best we can to maintain as much privacy for people, because it really isn't anyone else. Like, other than public health rationale, they do have a right to privacy. So, so this leaves it open to either.
Okay.
Well, maybe you want to put the Board of Health first.
I would say put the Board of Health first, and if they want to tell their supervisors, they should.
Okay, that works.
Yeah, but I think the supervisor has to know almost immediately. So
Absolutely, John.
Yeah, as what Margaret was talking about, so we can take the appropriate action to protect the remainder of the employees or the public.
Yeah.
Yeah, notify
So
Jane and then the supervisor, I would say.
Yeah, it has to be almost simultaneously.
Yeah. Yep.
Because you don't want an affected employee waiting for the Board of Health to get back to him. Meanwhile, the supervisor doesn't know, and he's working around, or he or she is working around other employees waiting to hear back what to do.
So
Right.
what I would anticipate and have experienced is that when people contact me, it's like, okay, are you going to call this person or shall I? So there's just there's coordination that goes, and I think 29 times out of 30, I think that people are going to naturally tell their supervisor and tell the Board of Health. We just want to be careful about having a policy that requires them to tell someone that they're uncomfortable doing so. I mean, if there's any chance of protecting their privacy, we should at least try. But so that's. Are we okay with the way that this is written, or do we want to come back to this?
Hang on, let's see.
It looks good.
I mean, we should settle this right now.
Yes, I think we should. And
As I stated and Mark said, a supervisor has to know almost immediately to take the appropriate action to protect remaining employees and their public and themselves.
Yeah, a supervisor is supposed to be trained enough to know they're not going to go around saying anybody's got a disease or anything.
Right.
They should be, we're all trained at Cranes that keep your mouth shut about stuff like that. Mm-hmm.
Okay. So all right. So so do we want to move it back, or is that fine for now?
I do have one question though, Jane. The reason to go to you is because you can determine whether or not there is a quarantine issue or not, right? And if there's not if this employee really isn't needing to be quarantined, and you let the supervisor know, could that cause more frustration with, I think I'm going to get it now kind of thing, versus maybe they wouldn't have gotten any kind of close contact?
Yeah, I understand what you're saying, Sandy, and I will tell you that a lot of my conversations just in the past week have been like, okay, let's really look at this. Okay, so actually you were in the office, but you didn't see that person, so they have nothing to worry about. So there's a lot of triage like that, because people are understandably have heightened emotions, that they're nervous. And so there is some value. I think that people find value talking to me. I don't know. You'll have to ask my husband. But I think that there is, as long as the thing that we want to avoid is that actions taken before they contact me. So drastic action such as sending everyone home, or drastic action shouldn't happen until they get a hold of me or the public health nurse. That's the thing that I'm trying to avoid.
I think it can be simplified. It should just be Board of Health and their supervisor. I mean,
All right.
Yeah, good point, Dan.
we don't need to necessarily beat this bush
Right.
all night.
All right. Because it will come in handy later, I promise. But
Yep.
yeah.
Yeah.
I like that. I'm happy with that. Are you guys okay with it?
I'm good with it.
Yeah.
All right, great. So that's that. That's what we're required for the state. We have a form that we need to sign. Sandy can sign it, and we have some postings that we have to put up, and then we're in complete compliance with the state. So that's that.
Okay, do we need to vote on this to adapt this?
If you'd like, you can.
I think we should.
May I suggest possibly looking at the next one and then adopting both of them at the same time, just in case there's a major change?
Okay?
Can I interject for 1 second, please?
Sure, Dan.
Just so the select board is aware, this spring we worked on a dedicated line in code red in which if there's a need to notify employees who are not at the town hall yet, not to come into the town hall for some reason, be it an exposure or something like that, we can send a message out to the employees that work in the town hall to let them know, stay away for this period of time, for whatever reason. Just so that you're aware, we set it up with the idea if we're gonna have a snow day or if we had something else, but it could also be used for this. There's a few people we need to add, new select board members, things like that. But other than that, we've got everybody that works within the town hall. We have run tests on it and it has worked very well. So, so you are aware, we do have that ability.
Oh, that's fantastic. That's really a good thing to know.
Thank you, Dan. All right, so now we have, this is a little different. This is actually the COVID policies that I'd like for the town to consider adopting. And it's funny because it's kind of anticlimactic because really what should be at the end, the indexes, which normally are at the end or at the beginning, and it just, the way that the workflow went for this, that's how it happened. But this is, dang it. So this is, basically there's first responders and then there's everybody else, right? So in Dalton, law enforcement is really the only first responder that's kind of under the town's umbrella, but this is still a helpful chart and it will be helpful for the police, the fire and possibly the EMS. And it reflects the current thinking. Like, for instance, if a police officer gets exposed, what's actually, the state has said that they don't have to quarantine when they're out, they can come right to work. What's actually been happening is the chief has installed a policy where, if you get exposed, you wait till day 5 to get tested, you get your test results back, and then once it's negative, you can come back to work. And that is there's a lot of good logic behind that, but the state's guidelines, if we had an emergency or, an ice storm, with the state guidelines, those people could come to work, but they have to be monitoring their symptoms. They have to make sure that they're wearing PPE, and if they start to feel unwell, they need to go home. So, so that's the quarantine for 14 days. Everyone has to isolate when you're sick. And then the really value of this particular chart is when do you come back to work? Massachusetts is suggesting a symptom-based strategy. So there's symptom-based strategies and testing-based strategies. So this is the recommendation for the symptom-based strategies is like, so you have COVID and the clock starts ticking the first day that you start having symptoms, goes from 10 days out, okay? So in order to come back to work, at the very minimum, you need to be, at least 3 days have passed since you have recovered. What does recovery mean? It means no fever without medications. It means, your cough and shortness of breath have to have gotten better, and at least 3 days have passed since the symptoms first appeared. I think what we're going to find is that people who have been impacted with a moderate or severe case of COVID aren't going to be ready to come back after 10 days, but someone who had really mild symptoms might. What's accentuated on this is that it's not recommended at this time that we wait for a negative test, because a positive test doesn't correlate with their ability to pass on disease. So that's for symptomatic people. For asymptomatic, let's say you were going to travel and you just got a positive COVID test, you have no idea where it came from, then from the time you take your test, you have to go 10 days out, and then if you can't have any symptoms, and then you can come back to work. So just having that in a chart, I think, is going to help to have that out there to help guide people. But and you'll see ultimately, though, there's going to be a process for people coming back to work, so that we don't accidentally or inadvertently have someone come back that isn't quite ready, because we want to make sure that they're not contagious and that they're well enough to come back to work. The Baker-Polito administration on the 18th made it so that you can actually test out of quarantine early now, and there's very specific things that you have to do. Instead of getting tested on day 5, they're saying if you get tested on day 8, on day 11 you can be out of quarantine if it comes back negative and you don't have any symptoms. And so in talking to Dr. Dan Doyle, that's what he's recommending for people who are on quarantine, because it gets them back sooner, and it also tests a little later, so you would be picking up disease. You would be having a higher chance of picking up disease during that transmission period. For some people that want to do the 14-day and get tested earlier, sometimes there's public health logic to find out earlier if they're infected, but if they are willing to wait the couple extra days to day 8, then they might be able to be released from quarantine on day 11. So you'll see later on that we're asking people to do a daily screening log. This is what it looks like. So here's our COVID symptoms, and just write in the date. This might be different. This might look different. I just did this today. The other option was having people sign an affidavit, and really we just want people to be reminded to monitor their symptoms. And Pat did text me and said he has extra thermometers. So if we give people the ability to check their temperature, and they're keeping kind of like a check on themselves, then this log could be kept in their desk and just kind of a reminder. So now we actually, again, went to document definitions, okay? And so I won't go through all of this. I will tell you that I added something. The secondary contact, a lot of the questions that I've been getting from people is, hey, my wife was exposed at work, can I come into work? And the answer is yes. If someone that's living with you was identified as a contact and is quarantining, that doesn't mean that other members of the household can't go on with their lives. You just need to stay away from the person who's quarantining. And I would say that I get a couple of calls a week from people asking this very question, and so I've incorporated it into the policies that you'll see. So now we're into the policies. Are any questions right now, or keep going?
Good.
All right.
So Jane, this is
Yes.
Richard.
Hi,
Can I
Richard.
ask one question? I thought once you're in quarantine, you have to be cleared by the public health nurse to come out of quarantine.
Yep, and you'll see those were just those weren't the actual policies. You'll see below that there's in the policy and I talked to Dawn about this. The Board of Health or the public health nurse needs to clear that person to get out of quarantine, so that someone's handling that case. And so what we would anticipate sending Dawn is, or what we would be collecting is that negative PCR test, the public health nurse release, and then checking with them to make sure that they're not exhibiting symptoms. And then the Board of Health would say, this person's cleared to come back to work. And there would be some sort of an email sent to Dawn indicating that this person's cleared to go back to work. We just haven't gotten there yet. That answer your question, Richard?
It does.
Okay,
Thank
great. The reason why that's not at the end is I can't figure out how to make the wide pages be at the end, and I didn't want to mess up all the formatting, but I think it probably belongs there. So, employee has symptoms. This goes right back to what we were talking about earlier. Contact either their direct supervisor, who shall inform the Board of Health agent, or contact the Board of Health agent directly to report their symptoms. And I will make sure that that's consistent wording between the two. I can't remember entirely what we came up with that wording, but is it okay if I just change that wording so it matches the other one?
Absolutely.
All right. So, this is the places that you can get tested. you know, what should you do when you're sick. So these are all links. So if we send this to people digitally, they can press control and click on it. Number 4 is really important, right? So we're asking people, if you're not feeling well, that's the time to think about, okay, I started not feeling well yesterday. In the previous 48 hours, who are the people that I was in close contact with? Close contact is within 6 feet for 15 cumulative minutes in a 24-hour period. The time to capture that is as soon as you start feeling yucky. And so really reminding people that that's really important for them to do. You know, not equally as important, but also important is identifying the people who you were around that weren't close contacts, right? So, like if you were hung out with someone 3 days before symptoms starts, they're not going to be on that list. If someone came into your office and dropped something off for 5 minutes, they're not going to be on your list. If you were across the room 10 feet, they're not going to be on your list. And the reason why it's, and then also the people who live with close contacts. So if you work with Joe's wife isn't going to be a close contact of yours unless you spend time with them. The reason why it's really important not to muddy the waters is that the public health nursing tracking is under tremendous strain right now. And even the governor came out with prioritization, the need for prioritization of contact tracing. So we really only want to get the names and follow up with the people that are close contacts, because we don't have the capacity as a region to follow up with secondary contacts and deciding who actually wasn't a close contact. Because even if it's taking 10 minutes from a public health nurse, that's 10 minutes that she's not working with someone who actually is a close contact and needs to get tested. So, so that's something that we'll be enforcing or reinforcing for people. And then number 7, so the employees strongly encouraged to notify their close contacts, and that the close contacts may want to take precautions. And I did run all of this by the lawyer, and we talked about some of the wording. We changed some of the wording on his recommendation. So number 7 is if there's a confirmed COVID-19 infection that has contacts in the town, the Board of Health, so it might be me, it might be the public health nurse, right? I might call Leslie and be like, here's the people that need to be called. If you're a close contact, you're not going to be told who it is that you contacted. All the public health nurse is going to say is you've been identified as a close contact for someone who's tested positive for COVID-19. And that is to protect the privacy of the person. Sometimes people can figure it out, you know, but that's not for us as a town to tell. And what will we do with that information? So the close contacts will be informed, and the employees / contractors needed to properly sanitize the affected work area in order to ensure compliance with privacy law, with applicable privacy law. You know, I've been working with Pat. We're trying to figure out how to tell the cleaning people that they need to go in and sanitize without betraying that person's diagnosis. And so we're going to continue to try to keep that as private as possible, but that is a piece of information that will be shared, and we just need people to understand that because there's public health rationale for sanitizing it, that whatever we'll try our best not to have the fewest amount of people possible notified of the space, because again, sometimes there's only 1 or 2 people in the space, so it's not really that difficult. So that is for people who have COVID symptoms. Is there any questions for that policy?
Nope.
Okay.
Anyone? Nope.
The second policy is close contacts of a COVID-19 positive case. Then this is, Joe brought this up, and I did follow up with the town attorney on it, and we came up with this wording. So close contacts who have been ordered to quarantine by the local or state health official, most likely the public health nurse, will be eligible to use both the FFCRA, which is the family, I don't have it in front of me, so I can't remember the words, but it's part of the CARES Act. It actually expires at the end of 2020, but his feeling was that there's a good chance that it will continue, and it provides some extra time for people who are impacted by COVID. And
Even for the audience, FFCRA is the Families First Coronavirus Response Act.
thank you, Joe. And it covers like, well, you'll see in the next one. So they can use that time. I think it's up to 2 weeks of time, and then they can also, after that point, use their sick time. And then we put as eligible by law because we don't know what the situation is going to be in January. On the same token, remember how we said that secondary contacts, that they don't need to quarantine because their secondary contacts were not exposed to a COVID positive person. So they don't need to quarantine, but sometimes the secondary contact will have a child or a dependent that is either quarantined, they could have COVID. And so that FFCRA also allows for the employees to take time off to take care of that dependent. And this is in direct, I don't know if conflict is the word, but it does not follow the current policy at all. The current policy for the town of Dalton is if you have a sick kid, you can't use your time. You have to use personal time or vacation time to take care of that person. And so this is a big change, and that's why it's highlighted. I think it's an important change, and it might not be a forever change, but for right now, I feel like, A, it's the law, but B, come January, and let's say the FFCRA goes away, I still think the town needs to consider whether or not they're going to support these employees to take care of their dependents who are out under no fault of their own. Does anyone have any thoughts about that or feeling that against that, revising that policy for COVID-19?
I like that.
Yeah, this is a big one because the FFCRA is very helpful in covering the sick time, if you will, or taking the time off if you're impacted by coronavirus. But as Jane mentioned, it does expire at the end of the year. But what I'm hearing as well, Jane, is that's going to be extended. But for some reason, if that federal reg does not get extended, and we have employees that are impacted, and they don't have enough time in their sick bank, that's the question. Do we make an extended benefit, if you will, that doesn't impact their, how do we balance that? Because we don't want them to come back into work, and we may be in a position that, I don't know if we are or not, I guess there's a question for Sandra, to support those town employees if they don't have time or whatever the case might be. Or maybe we cross this bridge on I don't know what the right answer is, but I'm just, the empathy in me just kind of comes out, if you will, thinking about this.
We may have to cross the bridge on a case-by-case basis, but currently in our policy, sick time is not used to care for any individuals that are in your family. Sick time is used for your own sick time. But based on this regulation, it does make sense that we should probably change that policy. It's not a bylaw or anything, it's just our salary, fringe benefit policy. And there is an option if someone does use up their sick time for their sick time, which could be extended if you decide to change the use of sick time. By a vote of the select board, there's something written in the policy that will allow extended sick for a certain amount of time. I can't remember exactly what that length of time is, but that has been used in my tenure here for a couple of people who did not have sick time left, but yet were out on sick even with surgery and so forth. So there is a method to alleviate if their sick time is all used up, already in place.
Okay.
But the question here is, we have to change the policy because our policy states emphatically that sick time is to be used for the employee and not for care of a dependent. So that is something that needs to get changed, I would say.
Can we just put an amendment to that, Sandy, for COVID? I mean, in the case of
Yeah.
COVID, we don't have to
Yeah,
change
sure.
the whole thing.
Yeah. Definitely.
Specifically dependent care around COVID-related illness.
Right.
I think dependent care should be addressed writ large, but for now, I agree, COVID-specific dependent care policy. And maybe we could get something drafted up in time for our next meeting in December.
Now, this is a policy. If you adopted this policy, would you also want to go back and change it in the other policy, or could this just be like a superficial COVID overlay? Because here it talks about it's due to COVID-19 related reasons. So would you need to go back and change the other policy, or could this just be in its stead while COVID is around?
Yeah, I would think that the other policy needs to be updated. I guess, Sandra, just for audit purposes, if, we go back through financial audits for this year or whatnot, but I would think there has to be some tie there.
Yeah, you definitely need an amendment. And Bob, that suggestion you had is a simple amendment to that policy. It actually, the verbiage here could be, put right into that, under that sick policy.
I think we can just add right here that this supersedes the town's the current policy for family sick time for right now.
Yeah.
We can add that in here, and I agree with Dan that we need to go back and also address the town's policy or the benefits and take care of that also. But I think if we could just add a line in there right now saying that this supersedes the town's current family sick time policy.
Due to COVID-related illness only.
Right. Yep.
Yeah.
I'll go back and change it.
Yeah, I'm not sure what Berkshire is doing, but I know over at Bay State there's a movement to use more intense remote patient monitoring, so discharging patients sooner that are stable, but yet could be remotely monitored for pulse oximetry and things of that nature. So I'm not sure Berkshire is doing that, because that could be a case where an employee needs to be at home more often than not with that particular loved one.
Yeah. Yeah, it doesn't necessarily mean a child, does it? Yeah, that's a good point.
Right.
So are we solid, I think, on this?
I think so.
All right.
I want to add right in there, though, supersedes the town's current family sick time policy, right? You want to put family sick time?
Yeah, got it. Thank you. Okay. So I did run this by the chief, and so this is what they're doing. They're testing on day 5 after the last exposure, and will not be eligible to return until they receive a negative PCR test unless needed for critical department operations. If they do come to work, and they need to quarantine as like a normal person outside of work, but if you are going to come into work you need to be monitoring yourself for illness. You need to feel well. You need to wear a mask, sanitization, and stay away from other people. So that's a proposal for the work that's more specific to the police station, because they are different, in a different class than any other town employee. So the town of Dalton face covering mask policy. This is basically follows order number 55. It was a little bit different because now it's in any public space. And so basically what this says is you have to wear a mask or face covering when you leave your designated workstation, when you're interacting with other employees from a different workstation. What does that mean? That means if I come into Sandy's office, Sandy has her mask on, or she can be typing away without her mask on. As soon as someone different comes in, she needs to put that on from different workstations. And whenever the public comes in, then you need to be wearing a mask. And that includes public spaces that are indoors and outdoors. So that means we really should be wearing, according to the state, we need to be wearing it when we're on sidewalks. Some of the smaller towns have made an exception if there's not a sidewalk and it's just a road. But Dalton has mostly sidewalks. But anytime that you see other people, that mask needs to be on. And we did receive some clarification that the police, when they're doing police road detail, are not exempt from that. In other words, the police, when they are doing road detail, that's considered a public area, and so the president of the Mass Chief of Police Association sent out a letter saying, hey guys, when you're out on road detail, you need to have a face covering. So that's something that's been decided on, and it's memorialized in this policy. Other thing is shared car ride policy or carpooling. Try not to carpool. Sometimes you have to, especially the police, and everyone's wearing masks, the windows are down. And then the other thing is really logging that time, because that really is intense time that you're with someone else. I think we might be, and then the sector-specific policy is there's the office, which we've already gone over. There's DPW with construction. When you have the senior center with some of their activities, so we all have to follow that very specific sector policies. And that's just memorializing that, because those will change over time, and just saying, we expect all the activities that go on in the town to be. So before I go to, I think, what's the final policy, are there any questions?
So, Jane, with the transfer station, we're going to put signs up to make sure everyone wears masks?
I think that's a great idea. People should be wearing masks at the transfer station. Yep.
Because there's a lot of interaction there.
Yep.
Just a comment.
Well, yeah, that would be a public space, and that would be subject to certainly subject to the governor's order. So this is a recreational travel policy. Long and the short of it, unless you're in an exempted activity, if you go to Connecticut for Thanksgiving and you come back, the long and the short of it is that if you come back and you have to quarantine either for the 14 days or until you get your negative PCR test, that will be your own time, and not either from the Family First Act or the FFCRA, or really even sick time, unless it's approved in advance by the town manager. Because, there's always a human side to things, and the town manager, that's why they get paid the big bucks. So are you guys okay with that stance?
No.
That's in line with what Pittsfield is doing as well. And then the Board of Health agent will be clearing them to return to work.
That's good.
And I think above, I thought that I've written in there already, I will also put that, the Board of Health agent to be clearing to return to work up ahead. And I thought I had put that in after I talked to Dawn today, but I didn't. So that's all I have for you folks. You guys can choose to do it a couple different ways. If there is a motion to accept this group of policies, I would suggest that any sort of motion include that people need to be cleared to work by through the Board of Health, since we're not certain that that's in there, and any changes that you want. And then the COVID control plan is a little more administrative, but still they go hand in hand.
Okay. Okay, gentlemen, what's your flavor? You want to do it all in one or two separate ones?
I think we can do it all in one. Yeah.
Okay. Motion, please.
I'll make a motion, we approve the Board of Health's recommendations for policies and addendums that we've made.
Second.
Okay.
And sorry, just to amend that motion in that the employees that are impacted by COVID will be cleared by the Board of Health prior to return to work. Is that correct, Jane? That's the addition you wanted? Okay.
Okay. Okay. John, point of clarification. Do we have to vote on the first motion first or then the amended motion?
Well, Joe, do we really need an amendment to that motion? Because that was in part of Jane's recommendation, that Mark moved that we accept.
Yeah, it's not written in the policy right now. Jane needs to add it. So that basically gives Jane the approval to add it.
Okay. Let's just go with it then.
Well, then we should vote on the amendment first.
Okay. Okay, vote on the amended version. Okay, roll call vote. John?
Yes.
Joe?
Yes.
Mark?
Yes.
Dan?
Yes.
And Bob, yes. Okay. Now we need a motion to vote on the original, to accept the policies.
Just need a
So
second.
moved.
Okay? Okay, all those in favor, roll call vote. John?
Yes.
Joe?
Yes.
Mark?
Yes.
Dan?
Yes.
And Bob, yes. Thank you, Jane, for your hard work. Appreciate it.
Thank you,
Thank you,
Jane.
Jane.
And I'd also like to thank you and working with the Central Berkshire Regional School District to keep in contact with them, and it's, you know, and we'll be getting to that shortly. But I was very impressed how you guys were talking to each other and made that decision for the safety of the kids. I appreciate that. Okay. Thank you. Okay, next on our agenda, we have the appointment of a full-time police officer. And we have before us Joshua T. Bradley. Okay, Joshua, I see you're on here someplace. Ah, there you are. Okay. Let's see, I got a couple things to read here. This is to Sandra Urbano and myself from Chief Riello. We hereby recommend to the Select Board Joshua T. Bradley of Dalton for the appointment as a full-time officer effective November 23rd, 2020. Officer Bradley was appointed March 11th, 2019, has been serving as temporary full-time officer since June 9th, 2020. Officer Bradley will be allowed to work as a permanent full-time officer until he can attend the next full-time police academy in March with a temporary waiver to MPTC. And he's got his resume attached to this, and we also have a recommendation from our acting town manager, from Sandy. I hereby recommend for your ratification appointment of Joshua T. Bradley of Dalton as a full-time police officer. This appointment is effective November 23rd, 2020. Officer Bradley has been serving as a temporary full-time officer since June 9th, 2020. Okay? A motion to accept this gentleman, please.
I'll make a motion, we approve Joshua Bradley to the position of permanent full-time officer.
Second.
Okay, a motion's been made and seconded. Is there any further comments?
I have a comment, Mr. Bishop. I'm very familiar with Mr. Bradley and his family. He's going to be an excellent officer. He'll be an asset to the community.
Beautiful. Okay, and thank you for everything you're doing out there, and please stay safe. Okay, any other comments? Okay,
Chairman?
yes.
If I may, if you recall,
You faded out, Dan.
I think it was the chief.
Oh, the chief? Oh,
yeah, it's Chief Riello. All right,
hey, how are you doing?
I'm okay. How about you?
Good.
All right, that's good. I just wanted to make one point, and I know you recall, Mr. Chairman, because we were both there when we witnessed his interview before the interview panel for the position.
Oh, yeah. Yeah.
Bradley did a fantastic job, and I know you made some very astute observations about him and the way he handled the pressure of that interview. And I will just echo what Selectman Strout said. I think he's going to be an excellent officer. He's a great kid and has a bright future. Thank you.
Yeah, I have to echo what Chief said, because I sat in on that interview. I was extremely impressed at how seasoned he was and how he answered the question, because we had the cheat sheet, so we had the answers so I could follow on.
Yes, we did.
But I was totally impressed how much knowledge he had for being on the force in such a short time. And I really appreciate it, and it's a bright future for the department. Thank you. Okay. Roll call vote. John?
Yes.
Joe?
Yes.
Dan?
Yes.
Mark?
Yes.
And Bob, yes. Congratulations, young man.
Congratulations, Josh.
Thank you very much. Congratulations. Thank you.
Okay. Stay safe. Okay. Next, we're going to do the Central Berkshire Regional School update. And I see Leslie on here and Mr. Bueno, correct? Okay. Leslie, would you like to have some opening comments or anything? First of all, thank you for coming before the board and making yourself available. Appreciate it.
Yeah, so thank you for inviting me in, and thank you for setting aside the time. And you know, I also want to recognize my colleague, Mr. Greg Bueno, who's you know, I couldn't do what I do without all the hard work that he does. And you know, you know, as I'm listening, one thing I do want to mention is, and I think you referred to this, is, you know, the collaboration and support that I received from the Board of Health, Jane Smith and Dr. Doyle, our public health nurses, is so invaluable. Like, we really, as a school system, we wouldn't be able to run and operate as safely as we do without them. So that's been absolutely just been, I just can't say enough how valuable that's been for us. But just to give you basically a little summary. As you know, we were in a hybrid model of operation, and that you know, just to again summarize, that's been going that went extremely well. I will say that despite having, we have had some COVID cases. I'll give you a summary of that in just a minute. Despite having some COVID cases in our school, as time has gone by, one of the things that we've been able to identify is that those cases have not been caused because of transmission in the school buildings. So in other words, the way we've been able to do that, I suppose you can't ever do that maybe 100% of the time, but we know that those individuals have been close contacts outside of school. So, and then what happens is we pursue contact tracing with the help of the public health nurse. And as time has gone on, any individuals that have potentially been close contacts in our school system are testing negative. So some of the, you know, the reason for going hybrid was cohorting our students, was really putting them in groups to reduce exposure. It also makes for less students in buildings. And when we have less students in buildings, what that does for us is we can ensure that in classrooms, all students are 6 feet apart. We can also ensure that when students are eating lunch and they don't have masks on, that they're at least 6 feet apart. And that's been a challenge for capacity, because I know sometimes I've had several community members ask me and say, why can't we bring all students back? And one of the challenges that we've had is in bringing all students back, that would mean students doing things like eating lunch much closer together, so they would be less than 3 feet apart, and they wouldn't be masked. That's been one of our biggest challenges in trying to think about bringing back more students, because we fully recognize that a hybrid model and having students in school, as in that model isn't enough. But our priority, as you know, is keeping everyone safe. A couple of the other things I just wanted to say about this sort of our hybrid model is, prior to students coming into buildings and staff, we did do some upgrades in terms of our HVAC systems. So we feel that, that was something that we were able to confidently move forward with to make our environments even safe. We do have a safety plan. We have, some of the things that I think are familiar to everybody right now, which is really prioritizing 6 feet of social distancing, mask wearing. I have to tell you that, prior to bringing students into the building and staff, I was not surprised, but I guess the level of compliance that we have around mask wearing, even with our littlest ones, has been amazing. Like they're just doing an excellent job of wearing masks. So just to give you sort of a rundown on the number of cases that we've had, and as far as, in terms of my role, I'm always cognizant of not only the cases that we currently have, and I really try to be very transparent in terms of reporting. So every case that we have had to date has been reported to that particular school community. I'm always cognizant, though, like I said, and aware of cases where there are individuals that we're waiting on results. So right now we've had 4 positive cases with individuals at Wacona. We've had 1 positive case at Kittredge, and we've had 1 positive case at part of the reason that we initially made a decision to go remote at Wacona is because at some point, Principal Rob and I had a discussion. We had at least, I think, 3 positive cases at the time. There were several students and there were some staff members in quarantine. And at that point, we were sort of asking ourselves, we were questioning his ability to get substitute teachers and run as effectively as we would like. So that's where we decided to designate a period of time where we would transition into remote. And again, I want to say that, that decision was made in consult with Jane and with Dr. Doyle, and, over the weekend, after hours. So, really, really, I can't say enough how much I appreciate their time. And then the second decision to go remote was a tougher one. And that was made primarily because prior to students entering the building, the school committee had entered into negotiations with the teachers and the staff, and they had really identified their level of safety as being as sort of color coding in towns. And one of them was, if any of the member towns move into a yellow, that we would transition to remote. Now, having said that, I think we made that agreement prior to sort of living it. And now that we've lived it, I think we really feel that it definitely could be more targeted by school. So similar to what we did with Wacona, I think we could definitely do it in a manner that's more targeted by school. So I think moving forward, we do have plans to open up discussions and to see if we can do it in a way that's more targeted. I think I can't tell you how much we value having students in our schools, and that there's no replacement for that in-person education, particularly with our little ones. So we are really trying to actively weigh out and balance. And I think this is something that in this sort of unprecedented time, you're always trying to balance safety with trying to make sure students have access to resources and that we're doing the very best job we possibly can in educating them. So I guess that's where we are in terms of, I guess that's some general information. And then I'll stop in a minute for questions, but I also do want to mention to everybody that on Saturday, I went on a tour of the new Wacona. And it's absolutely, you know, it's at the point where you can, you know, you can walk up the stairs. It's beautiful. It's on schedule. It's a beautiful building. The thing that I kept thinking about is it was reminding me of when I would bring my children to look at different colleges, because it's stunning. And like I said, it's going extremely smoothly. We are on schedule, on budget. So it's just, I just wanted to, you know, make sure to say something about that, because it's such a positive right now when I think there's so many other challenges. So feel free to ask questions about that as well.
Okay, is there any questions for Leslie or Greg out there?
I have a question, Bob.
Go ahead, Jane.
If that's okay.
Yep.
Leslie, when the Wacona is finished, is there going to be any lag time before the old high school is demolished to give you guys more space?
I would probably defer to Greg. I don't think there's going, I think that I'm sure there'll be some time. I don't think it will be demolished immediately. We haven't really thought much about using the old building in terms of space. I think we're thinking that at that point we'll all just be able to get back to normal. But, you know, to be honest with you, I haven't thought that far ahead, but I'm sure there will be some lag time just due to logistics. So I could turn it over to Greg, because he may know the details around that better, but I know there is a little bit of lag time. I don't think it's immediate.
Yeah, there might be a little bit of lag time, but we really don't want to be operating two buildings at the same time. So that's the other piece of it. So there's no plan to be occupying both.
Anyone else got any questions?
Hey, Leslie, this was a great update, and thank you to both you and Greg and for the great work you all are doing, and love the update. And I would love to put this, Bob, I think the idea is putting this on some sort of cadence, whether it's every couple of months or so, to have that conversation. But certainly one thing that's on the top of my list related to the school district is just the regional agreement and engagement in the regional agreement structure. So I don't want to go too far into it tonight, but because I know you have a lot going on, but maybe for the next update, if we can touch on that, that would be great.
Yeah, I'd be happy to do that. I think one of the things that both Greg and I are pretty committed to is, you know, keeping that line of communication open. We are happy to attend as you feel the need, or you can put us on the agenda more regularly, because you know, I think it's important, and like I said, I just, you know, I'm so proud to be in the role I am in this district. It's an amazing district. We have excellent educators, and I just, you know, walking through that new building, it just made me so proud to think that our students are going to be completing their education in their last 4 years in that building, and it just is a real testament to how much our community really prioritizes education. So, you know, I think it's, I want you know, make sure you hear firsthand, you know, some of those things as well.
And then the other thing, just a public comment, is that when you were appointed superintendent, I raised a question to the committee about the search process, but I don't think we could have picked a better candidate. So Leslie, again, thank you for the great work you're doing.
Oh, thank you.
You're here.
Thank you for everything you're doing. Is there any other questions for Leslie?
Mr. Chairman, just one question.
Sure, John.
Okay. Miss Blake Davis? Is that how you refresh the public's memory and mind. When is the proposed opening date of the new school?
So the proposed opening date is the first day of school for the new year. So I have to look at the calendar, to be honest with you. It's probably going to be somewhere around September 1st.
September of 2021.
Yes. So we'll be ready, but right now we'll be ready to go, but we're keeping our fingers crossed. It's going well.
Okay. And thank you. You're doing a wonderful job.
Thank you.
And I'm going to make my pitch again, Leslie, to call that cafeteria the 88 Cafe, as the vote passed by 88 votes, and reminds all the kids about the importance of voting in all different things. So again, great job by the building committee as well, and all the leadership there. So. Yeah.
It's been a pleasure working with Leslie in Central Berkshire. I deal with other school districts as well, and it's night and day. So hats off for your guys' ability, your willingness to work with the town. It makes a big difference, I think, for us to work together.
Well, I do thank you. It's a very, it's not an easy decision to think that you're moving students into a remote. I will have to say that's a pretty hard one. Especially when I do so much value, I do watch our educators work with our students, and as I've completed my walkthroughs, they're doing some great work with our students. So I want to get them back. I want to balance that safety and hope that Thanksgiving, it doesn't end up being an event that causes a longer delay to getting back to in-person learning.
I can't wait to come back either, because 5th grade math is killing me.
I know we just had elections for school committee, but do we have all of our seats filled for Dalton? I don't know for sure. I know there was some movements or not, but.
I believe we do right now. Greg, we do, correct?
You will, yes, I believe the new members will be starting, I'm trying to think, the next meeting is December 3rd. Will be the reorganizational meeting.
Thanks, Greg.
All right. Thank you, Leslie, and thank you, Greg. And is it okay to put you on the agenda for January for another update?
Yes.
Okay, I'll email you the 2 dates when we decide our meetings, and you can pick whichever you choose.
Okay, thank you.
Thank you. Okay.
Thank you.
Okay, now I'd like to open this license board. First of all, we need to approve all the alcohol licenses. Sandy, do you have anything to say on that before we do?
No, I think that you can go ahead. Judy's given you guys a few little spreadsheets that will help along the way.
Oh, we lost Sandy.
Yes, she's on mute.
Oh, sorry. You didn't hear me yakking, did you?
No.
So, so your question was if I had anything to say.
Yeah.
I want to. Judy did a nice little job with her spreadsheets. Did you all get your copies?
Yes, we did.
So, are you able to do what you need to do from those?
Yes.
Then I will let you go to it.
These are all updated from our last decision, right? As far as.
Absolutely.
And they still had to apply for their license.
Yep, they did. And
Yeah, they all have except one did not. And you'll see that in the folder.
Okay.
But
Just
everybody
looking
else,
for a motion to approve the 2021 liquor licenses, Bob?
yes, I am.
Okay, so moved.
Second.
All right. Roll call vote. John,
Yes.
Joe,
Yes.
Mark,
Yes.
Ken,
Yes.
Bob, yes. Okay, let's see. Now we have a change of manager at the Shire Brew House we need to approve. Did everybody get that package?
No. Jay, just ask you a question.
Yeah.
You just spoke about the one licensee that didn't apply for renewal of his license. Does that mean he's opted to go out of business?
That's what it sounds like to me, John. That's what I'm hearing.
That's what it looks like, but I don't have any knowledge of it, but
I don't either, but it's just, through the rumor mill and stuff, and there has been no, Judy called them twice.
Yeah, I know. She always calls and writes letters and make sure they do this. If you don't do it.
And everything, and no response, so.
Yeah. All right. Thank you, sir.
Thank you.
Mr. Chairman,
Yes,
are we still waiving the fees?
yes, yes. Yeah, that's all on effect, like John proposed, we're gonna review it in July, and
Yeah.
we'll rate them if all of a sudden they go back, after we get this vaccine out there and people can start opening it up again. I just wanna say one thing, I've had several people from different establishments thanking us for doing that, because it meant a lot to them. And
Yeah.
it's
Definitely proud.
because, like we said, I mean, we can't, I mean, the town needs these people, and we shouldn't punish them. So,
Has anyone actually paid? It just says it was paid on the spreadsheet to make sure people are getting a refund, I guess, if they've already paid.
Right, there was one that paid, they paid before the decision to remove the fees, and they are getting a refund of that.
Thank you, Sandra.
You're welcome.
Hey, Christmas presents.
Uh-oh. No. Everybody's all not there. Hello? Are you guys there?
Yeah, now we are.
Huh? Wonder what happened? My internet connection is unstable.
uh-oh, sounds like me.
Luckily, I am the host.
Oh, good.
Okay, we have a motion on the floor that's been seconded, I do believe. Who seconded that?
I did.
You, Bob.
Okay.
Joe did it.
We all did.
It's a group effort. Okay, roll call vote, John.
Yes.
Dan,
Yes.
Mark,
Yes.
and Joe.
Yes.
And Bob's a yes. And congratulations, Mr. Mater. Hopefully, when it opens up, we'll all be over there for some good food. Okay. All right, at this point, we'll close the licensing board. And we'll go to item 11, the police chief update. Okay, Joe, this is your time.
Yeah, let's be real brief. I thought I was going to have more information, but the Finance Committee was canceled tonight and pushed to December 1st. So as you probably recall from the last update, we have 16 candidates. We got 2 more in, so a total of 18. And proposed that we use a consultant group to help us navigate through the review of these candidates and the chief assessment program and the community program to engage the final candidates, et cetera, et cetera. So that ask for funding is in front of the Finance Committee, and their next meeting is going to be December 1st. And I shared some information with Sandra and Bill, and I'm waiting for 2 formal proposals that come in from 2 other firms. So there'll be a total of 3 firms that we're looking at. We have our committee recommendation, but we'll present all 3 proposals to the Finance Committee on the 1st. And pending their approval of reserve funds to fund this particular initiative, then we'll move forward with that program. Our target is to have the assessment of our top 3 candidates in middle of December. So we're trying to shoot for a quick turnaround time. But it's all dependent upon the access to the financials, or the funding, I should say, and then get the program moving forward and go from there. So.
Joe, one quick question for you.
Yep.
Other police search committees use these professional people, did they not?
They do.
Okay.
Yep.
Thank you.
Yeah, very common. Our recommended firm has served many communities in the Berkshire County area and across the state of Massachusetts. The other 2 firms are out-of-state firms.
Okay. All right, any questions for Joe?
Yeah, just one quick question, Mr. Chairman. Will the committee, you have 16, you say 16 or 18 applicants at this point in time?
18 now, yep.
18? Okay. Will the committee knock that down to a lower level and then have this
Yeah.
Does this company evaluate them, or will you have them evaluate the whole field?
No, we're gonna knock it down the top 6.
Okay, thank you.
There's a number of them that don't meet the basic qualification that we're looking for, so.
Okay. Anything else for Joe? All right, thank you. Okay. Next was acceptance franchise fee for the third quarter for Dalton Community Cable. A motion to accept, please. Joe, do you have that?
Sorry. Yeah, Mr. Chairman, a motion to accept the Dalton Community Cable Association franchise fee as presented.
Okay. For the record, it's $29,792.32.
Mr. Chairman, I don't mean to be corrective, Joe, but we don't accept it. We moved to transfer it from the town to the Dalton Cable TV.
That's a transfer.
Transfer, thank you, John. Yep.
Yep.
Okay. So the motion is a transfer of $29,792.32 from Charter Communication to the Dalton Communication Cable Association.
No, from the town of Dalton. We have it now, and we're transferring it to the Dalton Community Cable TV.
Correct.
Okay.
Okay, is there a second to the motion?
I second.
Okay, roll call vote. Dan?
Yes.
John?
Yes.
Joe?
Yes.
Mark?
Yes.
Okay, and Bob, yes. Okey dokey, let's see. Okay, next, we have a discussion on the town's manager's job description / salary. Sandy, I'll have you start us, and we'll go from there.
So we went forth with a draft job description, of which I think Joe made some changes to the draft, and I was wondering if he was ready to go through those changes, and if anybody else has looked at them on, I guess it was on Word. Is that right, Joe?
Correct.
Or not? Was it Google Docs or something like that, right?
Yeah, and on Google Drive. Yep.
So I would ask, has anyone looked at them? Has anyone agreed
I
with
was able to go through it today and make some corrections on it, and I don't know how quick a turnaround. I'd like to have it like, I know Joe, I don't know if Dan or anybody else has had a chance to go through it and look at it, but I don't know what the turnaround is on it, how quick we need it back. I know we want to get this moving.
Yeah, we're having our first interviews coming up in the next 2 weeks. We're interviewing 3 people, and we've asked them if they had, in particular, some questions to come before their interview, so we could speak to the board about any questions. And part of that would be the job description being proposed, I guess, versus the draft.
Sandy, will that be after December 14th?
Nope, they're all before.
Well, I don't have just talking personally, I do not have a copy of the job description and the proposed changes. And I'd like to have an opportunity to look at it and the proposed changes and even Mark's changes. And we make a final decision on the 14th. Yeah. If you don't have it in hand when you're going to be interviewing people, it's kind of tough.
They were all sent the draft as per your authorization to do that at the last meeting, and
right.
And I think that they were all sent via email. The draft as well as Joe's Google Doc.
John.
I beg your pardon?
Check your email. If not, let me know. I'll send it to you.
Yeah, it was sent on November 9th to the board at 10:26 p.m.
Uh-oh. I bet you sent it to that mass.gov email address.
No, sent it to John Boyle Dalton at Gmail.
You can get it, Joe?
Okay, I'll forward it to you
You
again.
got Hey, maybe whatever changes have been proposed, Mark, propose some changes in yourself, you can just tell us right now. I mean, if there's nothing significant. I mean, mind altering.
I was just going to say, the things, I only changed it, was for corrections and stuff. The content of it I was fine with. It was just some corrections I made for grammar and spelling and stuff like that, thanks.
Yeah, somebody will email me the original and the proposed changes. I'll take a look at it. If I got any suggestions, I'll get it back to Sandy right away.
Andrew, you want to review it right now on just the changes?
Yes.
Yeah.
Sandra, can you do the old shared screen trick, or maybe Jane, if you're still host?
I can, am I able to still do it if she's still host?
No, I don't know.
I'll check.
I think she already turned it back over to you.
Oh, jeez. Hold on. I'm coming. Yes, Joseph, you are able to host.
Thank you. Perfect. Okay. Okay, you should be able to see my screen, and we'll just go through the changes. So the definition, and so this is the Town Manager Act. No changes there, and then we get into the definitions. Basically, just add in that the town manager oversee the town master plan, the job environment. Town communicates with the town employees, department heads, committees, boards, and with general public, including media. We just added that part.
Joe, slow down a second.
Yep. So we add this part here in the red, including media. And then, again, part of the job environment has access to town-wide confidential information that was already in there. And basically just added, and is expected to maintain strict confidentiality of the same. Mm-hmm. And then the bigger changes are within the essential functions, that the town manager sets annual strategy and operational goals with department heads to support and deliver the master plan goals as established by the town. Proactively communicates with the select board with biannual status reports, annual town report status updates, and annual town meeting report, or report out, I meant to say report out, meaning report out to the community of the master plan status. No changes in number, all set there, number one, gents?
Yeah. Down to 2, yeah.
Yeah, number 2 is no changes, number 3, no changes. This comes from the original job description. 4, 5, no changes. 6, no changes. We completely struck out, and I think this was also a recommendation of the town manager search committee as well, Sandra, if I'm not mistaken.
Right.
To maintain a detailed calendar. Just didn't make sense because everybody kind of maintains their own calendars. It was a very micromanaged item there. Number 7, I recommend that we just remove assist select board in establishing goals and evaluating programs, because the select board doesn't really establish the goals or evaluate. We evaluate programs, but we don't establish the goals. That's really by town manager and the master plan. That's approved by the board, right? I added number 8 as a recommendation. Communicates with town staff concerning policies and procedures, ensures, I use the right word there, that boards and commissions are aware of policies and procedures and assist boards and commissions in advisory capacity. I'm trying to remember exactly what I was thinking when I wrote that, by the way. It's not making sense to me right now, so. 9 and 10, no changes. 11.
I think ensures is with an E, not an I.
Who said that? Thank you so much. I'm like drawing a blank.
Brittany.
Thank you, Brittany.
You got community, you just had one M up there, I saw. Right there. Yeah.
No changes in 9 or 10. Number 11. Assures that the town effectively pursues federal and state grants and all the sources of non-tax revenue. So added a suggestion here, the town manager shall promote the town through cultural, historical, business, and industrial grants. I think this came from that committee as well.
Yes, it did.
Community planners, interns, commissions, and committees should be utilized to help search for and write grants. So that comes from the recommendation of the town manager search committee. Number 12, responsible for preparing the town's annual budget for review and approval of the finance committee, select board, and we just added in town annual meeting. Number 13, facilitates the continued development of coordinated and just really said up-to-date technology systems. But we added, or I added a suggestion, and secure from cyber threats. So put it on the town manager's essential duties that we have a secure infrastructure, and we have funding this year to help close some of those gaps. 14, facilitates, coordinates long-range plan in all town departments and committees. And I just suggested in support of the master plan and town priorities. No change in 15. 16, works with town council on matters affecting town government and matters involved in litigation, and proactively informs the select board of such matters. Suggested number 17, coordinates, listens to, and actively engages with all town committees, may select to delegate department heads to work directly with the committees. And this would be like a lot of the different committees we have. We now have the Waste Management Committee, we have the Green Dalton Committee, etc. And I believe everything else was kind of a minor corrections, and just add working knowledge of current information technologies and working knowledge of information technology systems, but just put the word current. And that's really all the changes. So, was that helpful?
Yeah, I have no problem with it. I would like to add one change on my own. Maybe it's covered some other area I haven't seen. But the town manager advise any committee that's newly created or even in existence of the status of their function, their limitations, their authority, and the time and date of expiration at the time of the committee's creation.
So, I was going to take a crack as we're all together here.
I like that, John.
Was that Dave? Bob?
I like that.
Yeah. Not criticism of Ken or anybody else, but I've noticed over the years we've created these committees and they seem to have lost their way somehow. They're created for a certain specific charge, and they should adhere to that, and they should also have a time of date for either renewal or expiration.
How's that, John? Number 17 just expanded it. So, committee member
Defines committee term, yeah, and
defines committee term, revisits the
and defines their area, something like defines their area of interest or oversight.
purpose.
I'll go back and read. So appoints committee members, defines committee purpose, coordinates, listens to, and actively engages with all town committees, may select and delegate department heads to work directly with the committees, and also defines committee term and revisits the purpose, goals, and value to town. The town determines if the committee should continue at end of the term.
Hey, sounds good to me.
Okay, excellent.
Great addition, John. That's good.
Anyone else has any suggestions or whatever? I'll entertain a motion to accept this then.
So moved.
Okay, is there a second?
Second.
Okay, a motion's been made and seconded. Is there any further discussion? I'd like to thank everybody for their input on this, and if this helps, I think this will help the committee a lot. Okay, roll call vote. John?
Yes.
Joe?
Yes.
Mark?
Yes.
Dan?
Yes.
And Bob, yes. Awesome, guys.
Andy, I will make these corrections final and send you a clean version of the document. And
Good. Did Mark have any potential changes or proposed changes?
No, I went in and there was some spelling and stuff that I went in and fixed, John.
Oh, okay.
Okay. Next, on this, we need to put a salary range too. That's what's the other thing we're trying to decide.
Can
I
I?
think Sandy's trying to jump in here.
Yeah, can I bring up one? There's one question that came before. I haven't even passed this out to the committee yet, but there is in the Town Manager Act, I believe, is the requirement for residency after 1 year. Is that correct?
Oh, yes, you're right.
And so that is in this job description also under the last page. It's called citizenship and residency. So one of the questions that were asked by one of the prospective interviewees was whether or not a weekly residency would support this movement. So in other words, coming to town of Dalton, living in town of Dalton for the week, and then going back to where they live for the weekend. And there was suggestion that this is something that's done quite often. My thought on that is that this is a bylaw act, correct? And yes. Then therefore if the select board chooses that that is something acceptable they want to look into or entertain, then the bylaw will have to be changed. Is that correct?
Yes.
So I'm just putting that out there as a question that was asked already by a prospective interviewee so that you could think about it, I guess, as to either changing or leaving it the way it is.
Any thoughts, gentlemen?
I think it's critically important that the town manager resides in the town.
I do too.
Full time. We have a lot of weekend activity too, and I think the town manager should be an engaged resident.
I agree.
I want somebody invested in the community. So.
I'm somewhat in concurrence with what you say, Bob, Joe, but I think we could loosen it just a hair and like police, where they're required to live within 10 miles of the town or 5 miles of the town or something like that. There is a distance, and as long as they lived in a Dalton metro area, I would have no problem with it.
Yeah, the only reason why they have that, John, is from the civil service side to make it easier to recruit. You know, I think the town manager is a critical.
Well, hey, you guys think this? Hey, I'm all for it. If you think the prospective town manager should live in the town after a stated date, this just happened up in Adams. They hired a town manager. He was there about a year, and they had the same stipulation he was supposed to move there from Indiana, and his family decided they didn't want to move from Indiana to to Adams, and he resigned. This just happened.
Yeah, that was a temp police chief. Yeah.
Yeah. Was it a police chief?
Yeah, temp 6 months.
I think you're right, Joe.
Yeah.
Okay, Mark, you wanted to say something? I think you were saying something.
Yeah, it's the same thing they're saying is, I think we want somebody who's going to be invested in the community and available and become part of the face of the town. So I would tend towards wanting residency here.
I agree. Someone who will be impacted by the budget, by the taxes, and all the decisions that are made in solidarity. I can't see. I understand the desire to attract more candidates and get people to do this job, but I mean, I agree, and I think the town's voters agree as well because they passed the resolution.
Good point, Dan.
Okay. I agree with the board's thing.
Okay, thanks, John.
Thought it might be, but however, you must stipulate that this person has to move here and him and his family be full-time residents of the town within a year or a period of time.
So does it have to be his family? Can't it just be him?
Well,
If he doesn't have a family, maybe, right?
yeah.
Well, I think we're pushing the he thing. It very well may be.
No, I'm sorry. I'm sorry.
Yeah, I do the same thing, Mark. But we don't want the school with their superintendents in the past years, they end up in a situation where a person lived here 4 days a week and then commuted to New Jersey or New Hampshire. I just don't want somebody to be renting an apartment here and doing something like that, commuting to Boston, New Jersey, or something like that. I don't know how we handle that.
I agree, John. And the thing that does away with that is somebody who's just coming here for a short time and then trying to get out of here, coming in here for a stepping stone. So I think leave this in there, leave it the way it is. We're looking for somebody long term. We want somebody to come in here, and I think we just leave it the way it is, where it says they have to become a resident within 1 year. I think that's what we do.
Yeah, with that residency requirement, it's just a question. It's not on our agenda, but maybe a future agenda or finance committee item is, does the town pay relocation if we're going to make a requirement to move the town? So we find the right candidate who lives in Maine. Do you pay for relocation if you have the residency requirement?
I'd be in support of that type of benefit.
Yeah, I would as well. Yeah.
Some type of compensatory arrangement.
Yeah.
Is that something we could vote on a case-by-case basis?
Yes.
So we'll have to wait for the case to come up.
Right.
There's a comment from Becky Slick making a suggestion. Could we repost the new job description also include that residency is required? I think that's.
It's in here.
That's right. And
Yeah.
It's
It's under citizen. It's on the last page. Citizenship and residency. Those were from the Town Managers Act.
I think we're good on the job description, so I'll send that clean one to you, Sandy, and then you'll be good to go.
Okay.
Well, we got the vote on that, right?
Yes.
Okay.
So
Okay.
the next thing was what? Salary?
The salary range, Sandy. You asked us to give you a salary range, a recommended salary range.
Right, and I think you kind of said something about that last meeting, didn't you?
Yeah, John, I think John brought up he had one in mind. John, what was the one you had in mind?
I think you should establish a range.
Yeah, absolutely.
Obviously, based on the qualifications of the candidate and how bad you want them. And it probably should be between 100 and 125,000. Because that's the going rate.
Yeah, you look at these salaries here, I mean, some of these, wow. It's unbelievable.
Well, you got to remember the size of the town too. And the experience.
The town of Hatfield has a huge salary, and there's only like 4,000 people.
Huh?
So, Sandy, what was Ken's final numbers?
Do you still have that report right there? Do you have the report that?
It's buried in my paperwork, but I do have
I
it.
think it was like 114.
Yeah.
And that was, was 19
He was here
years.
17 years.
19.
19?
Yeah.
Wow.
I do like Mr. Boyle's range. I think that's a good range. It's wide enough and it gives us some room to move in there.
Okay.
Ken's final salary was $114,815.
Okay, thanks, Brittany.
Yep.
Was there a salary range posted with the original job posting?
No.
Was a job description posted?
No. Not with the job posting? No.
Okay.
Just.
I agree. 100,000 to 125,000 is a reasonable range.
Okay. Motion for it, please.
Mr. Chairman, I move that we establish a range for the possible procurement of a new town manager be between $100,000 to $125,000.
Is there a second?
I'll second it.
Okay. Motion's been made and seconded. Is there any further discussion? All right, roll call vote. Dan?
Yes.
Mark?
Yes.
Joe?
Yes.
John?
Yes.
And Bob, yes. Okay, Sandy, you got your numbers.
Okay,
Sandy,
great.
because we now have an amended job description or a job description period, and we now have a salary range, should we extend the period for applicants to apply for this job? Because it's going to be new information that may be of interest to qualified candidates.
So we've already selected 3 candidates as our initial interview. I would say that based on those interviews, if we need to reopen, well, it's still open anyway. It's not closed until someone's
Still.
appointed. But
Right.
if we find a need to have to review some more resumes, I think we'll
So-
make that decision.
What you're saying is there's still time for someone to apply with this new information that we have determined this evening.
I would say so if they're listening to this meeting.
The suggestion I have is that we re-advertise with the new job description and the salary range that we've approved.
Yeah, it's not a bad idea, Dan.
So, I have a question about putting a job. Where do we re-advertise that? I mean, how can the job description go in an advertisement? I guess is my question.
A link to the job description,
Oh, okay.
if it's an online ad, which I think most things are these days.
Yeah.
So,
I don't know what your channels are, but
so a link to the job description in the website.
Correct.
yes.
Okay. Along with a salary range that we spoke about. Now, the salary range, what is the basis for high to low?
Experience,
Experience. Okay.
Qualification.
qualifications, education.
Accomplishments.
Okay. Okay. And I think that could be re-advertised in the Beacon, and with that information at the, to check the website for those particular things we just talked about.
Okay, thanks, Sandy.
And the Beacon, is that MMA as well, I think?
I do believe so.
I think so. Yeah.
Sandy, you could put in there, when you put the salary range in there, subject to negotiation
Right.
for the qualified candidate.
Okay. All right. I think
Okay,
that
that
could
answer
be.
your question, Sandy?
Yeah, I believe it's going to answer the question for all the committee members too.
Okay, perfect.
Great.
Thank you for all the work you're doing on that. That's good.
You're welcome.
Okay. Now, while we got you on the spot there, Sandy, do you have any town manager updates?
I do. I just have to locate it. Oh, yes. So first of all, I want to thank Jane for all her work with the Board of Health and the COVID-19 protocols and policies and procedures. She's worked very, very hard on that. And I don't think we wouldn't have it to this date if Jane wasn't the one steering it. So I just want to thank her very much for that. Thank you, Jane. So another thing I needed to update you on is the Dalton Civic Arts Committee, along with the CRA executive staff. Since they're not able to have their traditional Light Up the Holidays event, they have decided to do something different this year. They want to have a Santa Wave Parade, and that's going to take place on December 12th at 5 p.m. The way this will work is Santa will be on the float and there will be no elves. There'll be Christmas music playing, and he'll have a microphone. He or she will have a microphone so they can talk to the kids as the float and fire truck and police cars drive through the streets of Dalton. There's no actual route been determined yet. I imagine that will be coming up pretty soon. So as you all know, that first Halloween family walk went pretty well, and I expect that this will go as well also. And so everybody mark your calendars. December 12th.
December 12th.
Santa Wave Parade.
Okay.
5 p.m. And that's all I have to report.
All right, thank you, Sandy.
You're welcome.
Okay, items for future agendas. Anyone?
Yeah, I guess a question for Sandy and also a future agenda, Bob. Item near and dear to a lot of our residents' hearts is the crosswalk issue. I know there's a lot of work going on, but I'm still not comfortable with progress. And I'm not sure if I'm looking in the right spot on our state website, but I don't see the project identified or moving.
Well, we have an RFP written up, getting ready to put an ad in the paper for that. And that outlines what, the bids and the bid dates. And so that's hopefully going to get accomplished this week.
Okay.
This looks as though it might carry over till next spring.
That's my concern. Is I really want to understand the timeline so we can communicate to the residents, because we've already communicated that we got the grant in October, and Sandra, it's not your issue as an interim town leader, but just together as a group, as a team. It's been out there for 4 years, so I just don't have something concrete to say this is the plan or this is. And I think we need to just communicate that to the town and say this is what we're doing. This is how it needs to roll. I just don't have that understanding, and so I'm kind of asking. So
how's that? I wasn't aware that it was a 4-year-old plan.
It's been out there for about 4 years.
Yeah, at least. Dan Filio, do you have any timetable on this?
Dan, you're on mute.
He's on mute.
Yeah.
The issues that we're running into with this are issues that are created by Mass DOT. We had started the project to put the streets in. We had applied in the spring to get permits and such. We did not receive the permits until 3 weeks after we had received the grant. Once we got the permits in, we started the other processes, and we have to follow the guidelines of Mass DOT. We have regulations on how we can do an RFP, We have to make sure that we follow all the state guidelines. And we, John Ruffley, Sandy, and the people working with us on this, Fuss and O'Neill, have been working on making sure that we're meeting all of those guidelines. And unfortunately, it's not a process. It's a governmental process. It's where we would wish it would happen immediately. It's just not happening there. And this is something that we've been in direct communication with the people who issued the grant. We have a report we have to file by December 1st on this, and where our progress is and where it's going.
Are we not getting a priority by DOT or response or anything? Because it you know, because of length of time, Dan.
Well, I don't understand what you mean by priority. There's rules and regulations within the state that says you have to follow certain guidelines when you put out an RFP. You have to put out for three different groups. They have to meet the guidelines of the state. They have to meet all of the regulations of the state. We cannot stop doing that just because the state's...
No, what I'm suggesting is that the town funded the project a year and a half ago, maybe? Was it?
No, they funded the project. Yeah, it was a while ago. I don't know.
It was a while ago. So all
2019.
the all the engineer work, all that stuff,
2019
would already be in the hopper.
No, you're not allowed to start any of that stuff until you have the permit. You can't. You're not going to spend money on doing engineering on a project if you don't have a permit for the project.
But we never got the permit.
You could end up spending $10,000, $20,000, and then have the state say you can't do the work.
So we have a DOT delay.
Well, it's because of the permit. We needed to meet the guidelines that DOT put forward for the permit, and that's the things that we had to do. There was things that they wanted us to correct. We corrected them.
So we can't communicate any type of timeline to our residents. Is that what I understand?
No. At this point in time, once we have the RFP, as Sandy said, that will be going out. As soon as that is out, then we'll have people put in for the job, and then we can build the sidewalk, the crosswalks. Believe me, I understand the frustration of the public. I've been the one who's been working on this since 2015.
Yeah, you have, Dan.
Yes, you have, Dan.
And it's just that, unfortunately, government moves slow. And I will tell you, there's things that the town of Dalton probably could have done better early on in the stage of this the program.
Well, I'd like to ask the board on this project, Bob, that we submit a letter to Paul Mark to grease the skids with DOT and get some attention on this project.
If I may.
Go ahead, Dan.
It's 5 years.
I don't object to it, but I'm not sure what Paul Mark can do about, we're following all the guidelines. We're doing what we're required to do. We're doing the same thing that Pittsfield's required to do when they put in for a project, or for any other community in the state.
So Dan,
they're not going to change the rules.
I appreciate that, but when Pittsfield got their shared streets grants, their bike lanes were up in about 3 weeks. All their engineering, all their construction, everything done within 3 weeks. We've been at these crosswalks, and this isn't to you, Dan, this is just my own frustration. We've been at these crosswalks now for 5 years. The town appropriated funding. We have no movement from DOT. We have a DOT issue, and I'd like the board to submit a letter to Paul Mark and ask him to fix the issue if there is an issue to be fixed. Or we'll figure out a timeline on when this can be done.
Well, we already have the permit, do we not, Dan?
Yes, we received the permit after we received the grant.
So what would a letter do to move this forward, Joe?
Bob, I don't want to be here in the spring and say there's no crosswalks done. That's my point.
One of the problems we're running with that too, Joe, is the fact is we're hitting a time frame where it's not a good construction season. And that is unfortunate, but that, once again, I don't think that's anything DOT has the control over.
Here's my concern, Bob, not Bob, but Dan, and to the board. The state of Massachusetts had a shared streets program grant specifically to help with the COVID crisis, to help with dining, to help with traveling differently, to help with all sorts of different things. And we put a grant in to help our children cross streets safely to get to school. That's the purpose of the grant during the Shared Streets Program grant for the COVID-specific crisis. That in itself should unlock movement for DOT to address these, and not in a winter construction thing, but the project should have been done based upon the Shared Streets Program grant back in October and November. That was the purpose of the state putting money out. So that's the Paul Mark angle, is that we got funds to do a project that's not moving as fast as the Shared Streets Program grant intended. And I don't want to be here in the spring with crosswalks not done. And I can't get a timeline. Not anyone's issue here, but it is the DOT that needs to give us a timeline.
Well, the timeline is going to be based on when the people can start the construction. Once we have got the award the construction to a group that, once the RFP is out. The state has no control over when we're going to do the building. They have the control over how we go about getting that paperwork done. And that's where we've been running into the issues, just making sure we're crossing our T's and dotting our I's. And, you know, once again, as I stated, I had the same level of frustration as you do. As I do. I would have preferred this was done by 2017.
This 5 years in the making. I think we need to put. I don't know what a letter will do either, but I think it's to make awareness to Paul Mark that he needs to put his thumb on DOT to have them move as quickly as possible when this comes across their desk.
You said the bids are going out this week, Sandy?
We're working on getting that in the central register. We're working on getting it out to bid, out in the paper, out advertisement.
When do you think that will happen?
I don't know. Sometime this week.
Sandy, do you want me to speak?
Sure. Sure, Becky.
I spoke, Sandy and I spoke about this morning, and I reviewed the RFP. It's over 60 pages long, and I made some changes to the ad, and I'm reaching out to town council. I actually sent him an email regarding this for them to look over the final RFP before we put it out to bid. So we are moving in a forward direction. We're not, not doing anything. It's just, it is a 60-something page document, and we had to make changes to the ad because town hall is closed. People can't come in and review the documents. We have to open the RFP on a Zoom meeting. So changes have had to be made, and town council is going to look at it and give us the okay to post it in the newspaper. And it has to be posted 2 weeks prior to give people a chance to look at the documents, have questions, have us answer the questions, and then we open the bids and we award. We can award that day, and then a construction timeline will have to happen after that. So we are making moves, and I am helping, and we have limited staff, and we're doing the best we can.
Okay. Why don't we wait till December 14th, our next meeting, and then see if we have a timeline with all these different avenues being pursued. Sandy with the RFP.
Submit a letter to our state rep. So that's a motion that's on the floor. If there's a second, great. If not, that's fine too.
Okay, is there a second to Joe's motion?
I'll second it.
Okay, a motion's been made and seconded. Is there any further discussion?
I'd prefer to wait till the 14th. And see where we're at by then.
I would like to see where this goes before.
We're waiting for 5 years. We need something.
I understand your frustration. I'm just.
It's not frustration from me, Bob. It's frustration from our residents. We need to.
Yeah, absolutely. We're all frustrated beyond comparison on this. But I don't see writing Paul a letter right now is going to move this forward anymore until we get this bids out there and we award it. Then we can write them a letter and get them moving.
And I'll reiterate, what we're dealing with right now is not Mass DOT doing anything to block what we're doing. Mass DOT has specific regulations that says you need to, you have to follow these regulations when you put up an RFP. That's why you write an RFP. That's why you get a 60-page RFP, and it has to go through the attorneys. That's the process that's been the hang-up.
The ask of the state rep is to make sure that we get the attention we need from whatever parties we need to leverage the Shared Streets Program grant funding.
Okay, let's go.
Permanent discussion.
Yeah.
Go ahead, Dan.
I don't disagree with you, Joe. At the same time, I'm not quite seeing how it's Mass DOT's issue at this point, because we need to get that RFP out.
Right.
Now, my suggestion, I agree with Member Boyle, that if we wait until December 14th, we could get it on the agenda, because another thing I would mention is this wasn't on the agenda. This was part of items for future agendas, but it turned into a longer
agenda.
Yeah, that's a good point, Dan. Yeah.
No, I just think we should stop talking about this and move on, and get it on the next agenda.
Yeah, let's put it on the next agenda. That's a good point, Dan.
And then the public can see it on the agenda and come and participate and hear the update.
Yeah, good point.
Okay. So we got to vote on the motion. Okay. Dan.
I'll resend. Mr. Bishop, I make a motion we take.
Okay.
Second.
Okay. Roll call vote, John.
Yes.
Mark.
Yes.
Joe.
Yes.
Dan.
Yes.
Bob, yes. Okay, we'll get it on the next agenda. Yes. Good point, Dan.
Thank you for your patience with this.
Just to point out that Dan is absolutely correct in indicating that we now have the permit. That is a big stumbling block with the state, because they never approved of this project in either locations before. They didn't want to fund it, and they didn't want to do it. We forced their hand, and so now they get the bureaucracy out there making sure we jump through every hurdle. And the biggest one is getting a permit to work on their property. We have that in hand. We have the RF things out for solicitation. So I'm thinking by the 14th, we should have a clear indication of where we're going to go. The only problem I foresee is it may have to wait till spring because of the inclement weather.
I intend to agree with you, John.
Yeah, hey, Bob, another future agenda item is the Rotary. DOT is going to come and give us a presentation at some point whenever they're ready on the Rotary issue.
Okay.
Yeah, but the Rotary isn't scheduled till 2024, so there's no need to really rush into this till we know more.
Yeah, actually, at the meeting I was with Dan, they're going to pull some additional updated information and requested that they come and give the board an educational session presentation about the design, the intent, and things. It's not a public hearing; it's more of an education for the board.
That's a good idea.
Okay, we will do that. Okay, anything else? Okay. Remarks of the select board, anyone?
Mr. Chairman?
Yes, Dan.
Just have a recommendation that some sort of update be put out to citizens, residents of town regarding the status of the town manager and police chief search. Now, certainly people can attend the select board meetings and read minutes, but I did receive some communication from residents just saying, hey, what's going on? I gave them a brief update personally, but that's just one person. I think people just are curious where we're at in the stage, in the process. So I don't know if that should come from interim town manager or from the select board, but I believe we should give folks an update.
Okay, we have Larry from the Berkshire Eagle on with us tonight. And I'm sure he's got a good idea where we are on our searches. And Larry, if you could please put a little plug in the paper for us where we are on these searches, it would be greatly appreciated.
Or see if you can put something on the website, or have somebody put something on the website.
Yeah, I agree with John and Dan. Good recommendation. We should put it on the website because part of our master plan is to actually improve communication with our residents, and this is
This is a status update. Good idea, Dan.
Well, let me just run this by you guys. I've got town accounting work to do too, which has not occurred, except for setting the tax rate, which is just about ready to be done. So I'm thinking that I need to get to that, or we're not going to get free cash certified.
Yeah, on this communication, if I may, Sandy, just recommend, like, for the police chief search already, because I'm the chair of that committee, and I'll submit it, and then I would say just ask one of the committee members on the town manager search to do the same. Really, I think, Dan, a summary of here's the number of candidates, here's the process we're going to go through. Stuff basically we're already updated, but just put it right in the spot on the website so people can go look at it. It's new news in town, and here's what we have. So we're not going to share anything about candidate names or any things of that nature, but here's where we are, here's the direction. Like, for example, for the police chief search, that committee said we want a chief that's going to be very community focused on community police and things of that nature. So I think those are good communication points. So.
Okay.
Mr. Chairman, can I ask Sandy a question?
Sure.
Sandy, you mentioned the tax rate that you're about to set.
Yes.
How much is it going up?
About 10%.
I'm sorry, I didn't hear you.
About 10%.
10%, huh?
It has to do with the debt for the Central Berkshire Regional School District. $1,260,000, something like that.
10%.
Who is the chair of the town manager search committee?
Steve Sears.
I'll reach out to him. And
Okay, thanks, Bob.
Yeah. I'll reach out to him, Dan, and see if we can give us an update here. I'll ask him to send it to Larry, and Joe, I would also like to have you send your thing to Larry also. Okay, anything else for remark to the select board? Chairman updates, I only have one, and I hope everybody out there has a happy and a safe Thanksgiving. Wear your mask, keep your social distancing, don't gather in large groups. I saw how Jane and Sandy have been working hard to protect our town employees, and you know, I still drive around town sometimes and there's people not doing anything they're supposed to be doing. It's kind of worrisome. But then again, you see groups of them that are doing it. So if we all stay safe and stay calm for the next few months, and hopefully this vaccine will be out so we can get back to normal. Okay? And that leads me to our announcements. Town hall is now, no, it's not. Okay. No, I'm not going to read that one. That shouldn't be in there. We still have a level 2 drought in the area, so conserve your water usage. The transfer station new FY21 prices. The first vehicle is $115. The second vehicle is $40. The bag prices for 30-gallon bags is $4, and a package of 10 is $40. And the 15-gallon bags are $3.30, and a package of 10 is $33. For a complete price list, go to Dalton-Mass.gov and click on the transfer station button. New hours for the compost and brush area. Tuesday and Wednesday from 2 p.m. to 5 p.m. and Friday and Saturday from 8 a.m. to 3 p.m. We have a couple messages from the Dalton Police Department. The police department is still open to the public, and the lobby of the police department is open to the public. Please feel free to stop in and see an officer. Social distancing and masks are required, and only 2 people are allowed in the lobby at a time. The processing of firearm permits are processed between the hours of 10 a.m. and 3 p.m. by appointment only. Please call 684-0300 to schedule your appointment. No walk-ins are accepted at this time. A check or money order for $100 made payable to Town of Dalton. Renewals over the age of 70 are free. And that's all I have on this. I got more on this one. The Dalton Library is now open from 12 p.m. to 5 p.m. on Monday, Thursday, and Friday, 10 a.m. to 5 p.m. on Tuesday, and 12 p.m. to 8 p.m. on Wednesday. Anyone in a high-risk population may schedule a time in the morning to come by themselves with no questions asked. The lobby pickup continues for anyone who would rather not enter the building. Call 684-6112 for more information. The winter parking ban is in effect from November 15th to next, I do believe it's next May or March, okay? So please keep your vehicles off the street, okay? And that is it, all I have. And a motion to adjourn, please.
So moved.
So move.
Okay,
Second.
okay, roll call vote, John,
Yes.
Dan,
Yes.
Mark,
Yes.
Joe,
Yes.
and Bob. Thank you, everybody. Good night, Dalton.